hoopla started up about hydroxychloroquine when Donald Trump mentioned it in the spring. And there was this very politicization around that drug, which of course is not political at all when it comes to malaria, which it's been used for decades. But suddenly, because it's about this new virus, and as Fauci said on live TV, disagreeing with Donald Trump, there's not enough scientific research. There wasn't, at least back in April, enough scientific research behind hydroxychloroquine to certify this is something that should be used. And some people have claimed, on the internet at least, that the government is trying to stop people from getting access to hydroxychloroquine. And from what I understand, that's not accurate. It's just a matter of it not being the most recommended thing.
First of all, Donald Trump shouldn't take credit for hydroxychloroquine, because the first studies of hydroxychloroquine came out from China, Russia, and Italy, where the infections actually took hold earlier. Since so many people were dying from the immunological response to the virus, the logical thing to do was to try and find agents that would dampen that response.
The cytokine storm.
Yes, exactly, yes. Drugs that were used, or that are used in autoimmune disease like lupus, like rheumatoid arthritis, there are conditions in which the immune system is overactivated, were seen as a potential avenue. One of those drugs, which is very widely available and cheap, is hydroxychloroquine. So this started, the use of the hydroxychloroquine, I remember it coming up on this blog from Italian doctors back at the beginning of March, because Italy went into shutdown in mid-February. Everybody was looking for a way to actually decrease the severity of symptoms, and they started using a combination of zinc, antibiotics to prevent the potential concomitant bacterial infections, and hydroxychloroquine. Again, we're talking about really fast times, right? Things moving really quickly, people going into panic and trying to, not having enough PPE, for instance, in Italy, and having to wear scarves to protect themselves from the virus, and say, what else can I do, literally, right? And I'm gonna do anything I can, I'm gonna try everything, right? Because I don't wanna die. Or in Russia, about 10% of people hospitalized for COVID would die. And then finally, when he came here, he immediately, instead of being portrayed as it was, as a last resource thing for people that are constantly exposed to the virus and that should be protected and trying to protect themselves, it started getting touted, as a miracle cure, with very little evidence. That doesn't mean that it doesn't work in some people, because the science, the mechanism, the thinking behind it is sound, right? I want to avoid the cytokine storm. Cytokine storm is what kills people with COVID, at least, acutely. I want to avoid the cytokine storm. I use drugs that dampen the immune response in order to mitigate my risk to develop a cytokine storm. The thinking is not crazy. It's right. It makes a lot of sense. But
and the zinc seems to help it absorb worse.
And the zinc is believed to be improving the stability of the immune system. And also they've seen in some in vitro experiments that together with hydroxychloroquine, it does work better. But, again, how valid those experiments is never been clarified, because really they're not duplicated. Then what you look at is, okay, what is the benefit versus the risk of this drug, right? For me to, US government or Italian government or French or, British government to recommend the therapy, I need to have an understanding of the risk benefit. And in this country, that's what the Food and Drug Administration is made for, right? They actually follow standards to decide whether something is good enough to go into the public. When it comes to hydroxychloroquine or chloroquine, it is not a benign drug. You know, it's used for a long time, but it's used in patients that have very severe diseases that if they didn't have something would experience, you know, organ failure, extreme pain. You know, it would be, you know, it's an important drug for these people where the risk benefit is in favor of giving it versus not giving it. But in healthy individuals, it can cause heart problems, it can cause vision loss, it can cause liver toxicities.
So if someone were choosing to use it as a prophylactic, it could even weaken the immune system.
Well, it definitely suppresses the immune system, so it may make you actually more susceptible to other infections. But also, it might make you more susceptible to developing heart problems, liver problems, because you're still taking a chemical which is actually quite powerful. Hematological problems, vision problems. So there are a number of adverse effects that have been documented with this drug.
Right.
So when it came to issuing a recommendation or approving the drug for use, this is not something that you do on the spur of the moment or just because you decide that you want to do it, right? You have to have very robust data supporting that drug. And the robust data is provided by randomized clinical trials that need to be at least a couple of them or have a representative sample size. They need to be prospective, so they need to be designed to prove that benefit versus the risk.
And so when people are saying the government is trying to stop me from getting a life-saving drug,
Right.
what they're really complaining about is the FDA didn't sanction it, and therefore it's not free under Medicare or some other health insurance that might have covered it if it were recommended by the FDA. But it doesn't mean that your doctor can't actually prescribe it to you, because many doctors have.
Yeah,
right?
Nobody stops any doctors from prescribing any drugs for off-label use. Individual physicians can prescribe any drug that they think is going to work for a specific patient, regardless of whether it is approved in that indication or not. When it comes to the government, or the FDA, or to pharmaceutical industries, they can only operate within the boundaries of the approved indication.
So people might, if they really wanted hydroxychloroquine, they could ask their doctor for it, and their doctor could prescribe it if he or she chose to do so.
Yeah.
But they would have to pay. They would have to pay for it out of pocket.
There might be some payers or some institutions that are willing to reimburse the costs of hydroxychloroquine, as in some cases they are willing to reimburse the costs of off-label medications for a specific use.
Right.
But at that point, it's no longer a government decision. It's an institutional decision, is a practitioner decision, is a specific agency, insurance, or payers decision.
And if they chose to use it, it's still not that expensive, right? So it's not like it would break the bank for most people if they wanted that drug.
There's nothing stopping anyone in this country, especially, from using it, as long as the doctor or the institution is willing to take on their own legal responsibility for prescribing it, and as long as the patient is willing to pay for it.